The dental hygienist is the preventive professional in the dental office. They're the person that is roughly the same as the registered nurse in the doctor's office. And so the dental hygienist does cleanings, x-rays, fluorides, sealants, educational, nutritional education, anything that has to do with preventing tooth decay or gum disease. That's what we do. We work in conjunction with dentists, and most of the time we work in private practice settings. However, dental hygienists can also work in schools. If the school has a dental clinic, we can work in the veterans hospitals, other types of hospitals, prisons, nursing homes. So anywhere there's people who need to have an exam and check, then we can work there. So and it's actually a really good job. I never planned to get into dental hygiene. About 40 years ago, a long time ago, I was studying to be an English teacher. And then I met this cute pre-dental student. And, you know, the rest is history. So I'm still married to him 38 years later, and he is the cutest dentist in the whole wide world. I'm a little prejudiced, but I kind of switched my plans. And so instead of teaching English to high school seniors who are bored to death, now I teach dental hygiene to our dental hygiene students. So it's really fun. We do have a dental hygiene clinic over in Building U, and you can all come and get your teeth cleaned there. As students at TSTC, it's only $10. So students, yeah, it's a really good deal. In private practice, if you get your x-rays or cleaning and your fluoride, it's about $150 to $200, depending on what kind of x-rays you have. So it's good. Do y'all have any questions you want to ask me? When you can, we have clinic on Tuesday and Thursday, and we do have evening hours. You just call and make an appointment. Okay. Any other questions? Let me tell you a little bit about the program. It is an associate degree program. It's extremely competitive. We take about 30 students, and there's about 150 people who apply every year to be one of those 30 people. And why do you think everybody wants to be a hygienist? It's so glamorous, right? Good pay, yeah, that's it. It's very rewarding. It is very, very good pay. We actually make more than registered nurses, and the nurses get kind of cranky about that because they have to work the midnight shifts. And why? Because there's not as many of us, I think. There has been a shortage, yeah. And so the Department of Labor estimates that through the year 2030 at least, there will be a shortage of hygienists and dental assistants. I'm also teaching the dental assisting program. And so there's jobs. Of our graduates that just graduated in May, everybody has a job. I'm going to share a little story with you. Here in the Valley, and you've probably heard this before, pay tends to be a little bit lower than if you go outside the Valley and go to San Antonio or Austin or Dallas or Houston. So when our students are getting ready to interview and go out into the job world, I said, don't settle for less than $25 an hour. I mean, just don't settle for less than $25 an hour. $25 an hour, right. I clean teeth. I take care of patients all day long. Yeah. So I tell one of my students, I said, so don't settle for less than 20, So she goes up to Houston and she's interviewing. And the office manager asks her what salary she expects. And she said, I'm thinking not less than 25. She goes, so I take a deep breath and I say, I want to make $27 an hour. And the lady looks at her. And she goes, what? She goes, we don't start anybody at less than $34 an hour. So, not too shabby. Now, it's an associate degree, but it's actually a 3-year program because there is a year of prerequisites. So you have to be THEA complete or AccuPlacer complete, and you've all taken, when do you take that, or have you taken it already? You'll be getting it? Okay, so you want to make sure you pass all 3 parts of that. Once you've passed your AccuPlacer, you have to take Anatomy and Physiology 1 and General Chemistry, and then there's a test in January called the TEAS test. And this is the test of essential academic skills. Depending on your score on that test, that's how we decide who gets in. So like I said, there's 150 people. Now, in our classes, we have people all the way from Canada. And again, people come all the way from Canada. At least a fourth of my class every year is from Canada. And Canada hygienists make a lot more money, and our program is so good that the word is spread, and we have people from Canada. We have people from Houston, Dallas, because like nursing. Yes, sir.
Ma'am, if you're like studying for that, right?
Mm-hmm.
Between the 3 years, you can start working for that.
You work in the clinic, you can't get paid. Dental hygienists are like doctors or dentists. They have to be licensed. So even when you graduate, you still can't go out into practice. You have to pass a clinical board where you have to take patients to a dental school. You have to pass a written national board. So once you graduate, you pass both your boards and apply for a license, then you're licensed.
How long will those two after you graduate? How long will that take?
Usually, they take their national board, their written board in March, and their clinical board right after they graduate. So usually by June they're working. So it's pretty good. So it's pretty cool. And I have to brag a little bit. Many dental hygiene programs, and this is why we have so many students, one of the reasons we have so many students from Canada, many dental hygiene programs are 4-year bachelor degree programs. The national board is the same that we have to take, whether you're an associate degree program, which is a 2.5, 3-year program, or a 4-year program. Our students, we consistently range at 97 to 100% pass rate the first time. We are right now doing better than UT Houston, UT San Antonio with their 4-year program. So you don't have to leave the Valley to get a really good education. The great part about dental hygiene, well, there's lots of great parts about it, is patient care. I really like, if you like 2 things you have to do. You have to like people, okay, because a lot of people don't want to come see us. It's hard to believe. We're nice people, but a lot of people are scared of us. Not nearly as much of the hygienist as of the dentist. My husband got real tired of people telling him, no offense, doc, but I don't like you. He's like, well, no offense to you, but I don't like you either. But no, you don't say that. But patient, you can't do that. You wouldn't have a practice very long. But so you have to be really good at psychology. You have to help patients be motivated to come back and see you and do what you're, and floss, because I know everybody just flosses every single day, right? Right. And so that's part of it. It's working with people. We had our own practice in Gibson City, which is a little town in Illinois, for 17 years before we decided to move down here and live in this beautiful place. And I got to see kids for their kindergarten checkup. I got to see kids when they went off to college, and I got to do their cleanings for their weddings. And there aren't many jobs that you get to have that kind of relationship with the people that you work with, because you see them twice a year, year after year after year. So it's a very, very rewarding relationship. So if you like science, because we're very heavily science-based, and you like people, it's a great career choice. Now, again, I said we're very similar to an RN because we have basically the same educational requirements. We have to have anatomy and physiology 1, microbiology. We have to have chemistry. Nurses don't, which I think is kind of funky, but whatever. I can't imagine trying to do pharmacology without chemistry. Chemistry is so important to figuring out dosages and those kinds of things. But the difference between hygiene and nursing is I never have to work on Christmas Eve. My daughter-in-law is a nurse, and she's getting her bachelor's of nursing. She's an RN, and now she's going on and getting a bachelor's of nursing. She has to work Christmas Eve. She got Thanksgiving off, so now she has to work Christmas Eve. I never, ever am going to have to work Christmas Eve because nobody comes and gets their teeth cleaned on Christmas Eve. Now, when we had our private practice, we went in late at night when a patient had a toothache because that's what you do to take care of people. But you as a practicing hygienist are not going to go in on a Saturday or a Sunday to have to work. So very, very rewarding, very stable. Usually, again, you're not working out in the hot sun. You're working in a nice air-conditioned office. There are pediatric practices. There are general practices, which is what we had in our practice. You have a little bit of everything. There are periodontal practices, which are people who have gum disease. And let me share a little bit of that with you about that. You all know about gingivitis because you've seen the Listerine commercials, right? That's when your gums bleed when you brush and they're red and puffy. Okay, no big deal. People don't get too excited. But what you don't realize is around your teeth, those gums have a very intricate blood supply. And so those bacteria and those germs that are causing your gums to bleed and be red and puffy are sent throughout your body. We know that women who are pregnant and have periodontal disease or advanced gingivitis and gum disease are 7 times more likely to have a premature baby. They're more likely to have a low birth weight baby. We know that having gum disease increases your risk of heart attack and stroke. We know it increases your chance of pneumonia. So it's not just about looking great and having a pretty smile, although that's what we all want. It's also about the total health of the patient. So it's pretty cool. So if you're interested, I hope I get to see some of you. Do really well on your Accuplacer. Take as much science as you can because everything is changing, very heavily science-based. Come over and see us if you really want to know what it's like. Make an appointment at the dental hygiene clinic, get your teeth cleaned, talk to one of the students. They're a lot more interesting to talk to than me. But again, they love what they do. One of the most famous things I really love is when I go to dental meetings. We have a lot of state dental meetings, and it's usually in San Antonio in May. I go up to San Antonio, I see graduates that graduated 5 or 6 years ago. They're doing great. They just bought a brand new 4x4 pickup. You know, their lives are wonderful. So that's really fun to get to see that. So,
Are there any questions?
Yes.
I have a question.
Sure.
Sorry, I apologize. Maybe I was out when maybe you already covered this. The enrollment process, is there letters or anything that they need to do?
They have to pass Accuplacer. They then have to take the TEAS test. It's given here during the month of January. And based on their score on the TEAS test, because it's incredibly competitive, I mean,
Is there a fee for that test?
it's $60. Okay. Mm-hmm. And
They go into your program.
they have to be accepted into the program. Yeah, it's not open enrollment. I mean, I have about 150 people who we call wannabes. They're people who are taking the courses. There's 11 non-dental hygiene classes: anatomy and physiology 1, anatomy and physiology 2, microbiology, chemistry, English, psychology, sociology, those things. They're taking those classes, getting ready to get in. And the other thing, you have to work really hard. I mean, they don't pay me $35 an hour because I'm gorgeous, okay? I wish, right? They pay me because it's very hard to get to be a hygienist. And once we're in the program, I'm doing midterm counseling for our first-year students who've been there since August. And these are students who are used to getting straight A's in all their classes, and they're all really having to work very, very, very hard. I had a bachelor's degree when I went back to hygiene school. Because like I said, I was going to teach English, college English, and then I got married and decided I wanted to work with my husband instead. I thought, how hard can it be? I had a 3.9 GPA at a university, so I'm a pretty good student, right? Hygiene school was the hardest thing I've ever done in my life. It's harder than graduate school at a Big Ten school because it's so intense. But in a little over 2.5 years, you're out doing something really rewarding. You're helping people and able to pay your bills, which is always a nice thing.
And acceptance into the program, when do you accept your homework?
The deadline for application, again, you have to take the test in January to be eligible before the March 1st deadline. In the program packet, and I have these here, they're also online, there's an application to the program that's special and different than application to TSTC. We need it before March 1st. We let people know by the end of March if they've been accepted or not. Okay, so that you'll know by the end of March if you've been accepted. But the big thing is pass your Accuplacer, take the TEAS test in January, and get your science done. That's really important.